Good day, everyone! I'm Lucy May Magpantay, 4th-year medical clerk from Emilio Aguinaldo College, School of Medicine. And today, I'm going to show you how to perform EINC, or the Essential Intrapartum Newborn Care. EINC is a package of evidence-based practice recommended by DOH, PhilHealth, and WHO as a standard of care in all births by skilled attendants in all government and private settings. It is intended to improve maternal and neonatal care. By changing the childbirth practices, the maternal and neonatal death could significantly be reduced. There are actually 4 steps in doing the EINC. In the Philippines, it is commonly known as unang yakap, and we commonly see it in ORDR settings. So, let's get started. Good morning, ma'am. I'm Dr. Magpantay, Pedia on call for today. I'm going to catch your baby. Would that be okay with you, ma'am? Now we go to APGAR scoring. It is a quick test that summarizes the health of our newborn. It is done 1 and 5 minutes after birth. The first minute determines how well the newborn tolerated the birthing process, while the 5-minute score tells how the baby is doing outside the mother's womb. APGAR scoring was introduced in 1952 by Dr. Virginia APGAR. APGAR score stands for A. Appearance, P. Pulse, G. Grimace, A. Activity, and R. Respiration. For each, we have the highest score of 2, so for a total of 10. Usually, there's no perfect score of APGAR, since a newborn could physiologically manifest acrocyanosis, which gives the category of appearance a score of 1. Now, let's start. For the first category, which is appearance, we inspect the color of the baby's skin. I give her a score of 1 since she has a bluish extremity or what we call the acrocyanosis. Now we go to the second category, which is the pulse. With the use of the stethoscope, we will listen for the heartbeat of the newborn. So we will use the bell side of the stethoscope since our patient is a newborn. I will give her a score of 2 since her heart rate is around 138 beats per minute. Next category is the grimace or the reflex irritability. So we will elicit response to stimulation. I'll give her a score of 2 since she felt irritable when I touched her foot, so she showed a prompt response to stimulation. Next category is the activity. So we are trying to observe or elicit the muscle tone. I'll give her a score of 2 because there is a spontaneous movement. Last category is the respiration. As you can see, the baby is crying. So I'll give her a score of 2. So all in all, the APGAR score of my newborn is 9 out of 10. Which means she is in an excellent condition. When the score is 0 to 3, it means severely depressed. 4 to 6 means moderately depressed. And 7 to 10 means in excellent condition. Then we will just repeat it after 5 minutes and then record it on the newborn's chart. Now we go to Ballard Score or Maturity Index. It depends on the neonate's neuromuscular and physical maturity. It is done up to 4 days after birth, but in practice, it is used within 24 hours. This is done if gestational age is uncertain or if the baby is larger or smaller than the expected. Let's start with the neuromuscular. It has 6 parts. The scoring is from -1 to 5. -1
is the most premature.
and then 4 is the normal. Starting off with the posture, the baby should be well flexed to be matured. If it's more of the extended or flaccid, the neonate is
Premature.
I'll give her a score of 4 since her extremities are well flexed. Next is square window. We assess the neonate's risk if it passes the 90 degrees. So if it passes, means the baby is mature. But if it doesn't pass the 90 degree, the baby is premature. I'll give her a score of 4 since her wrist is able to pass the 90 degrees. The next part or component is the arm recoil. So for example, if the baby's arm is like this, then we try to take it down, it should recoil back as a sign of maturity. But if it doesn't recoil after we pull it down, that's a sign of prematurity. I'll give her a score of 4 since her arm was able to recoil. Next is Popliteal Angle. So I will try to
Flex her leg.
and then I should be able to feel resistance. And I should not be able to
Flex it.
more than 90 degrees. So that's a sign of maturity. But if I am able to
Fully flexed.
all the way like this, it's a sign of prematurity. I'll give my patient a score of 4 since I felt a resistance and it did not go beyond the 90 degree. Next is scarf sign. So we will try to position the neonate's hand like this across the chest. So we should also feel a resistance. That's a sign of maturity. But if the neonate's arm could be positioned all the way to the neck like a scarf, so meaning it's an indicative of prematurity. I'll give her a score of 4 since I felt the resistance and it did not go beyond more than across the chest. Next is the heel to ear. So we will try to bend the neonate's knee and then try to lift the leg, and then upon doing so, we should feel resistance. And then it should not pass beyond 90 degrees as we lift it up. But if it goes all the way up to the ear, it is a sign of prematurity. I'll give my patient a score of 4 since it did not go beyond the 90 degree and it did not extend up to the ear. The next category of the Ballard score is the physical assessment. So it has also 6 parts or components. Starting off with the skin texture, if the neonate is premature, it will be sticky and transparent. But as the baby matures, it will thicken. And if it's post-mature, the skin will be leathery and wrinkled. In my neonate's case, the skin texture is thickened. Next is Lenugo. If the neonate is mature, there will be less Lenugo. Usually, they are bald. But for the premature, they have abundant Lenugo. And for the very premature, they don't have any Lenugo at all. She has a few Lenugo. Next is the plantar crease. We must be able to see creases on the sole of the foot of the neonate. That's a sign of maturity. But if it is smooth, it's a sign of prematurity. In my neonate's case, she has plantar creases. Next is breast tissues. For the premature, their breast tissue is imperceptible, but for the mature ones, they have full areola, 5 to 10 mm in size. In my neonate's case, she has around 10 mm areola size. Next is eyes or ears. For the premature, their eyes are shut. But for the mature ones, they can open their eyes. For the ear cartilages, if we bend the pinna, for the premature, it will stay there. But for the mature ones, it will recoil. In my neonate's case, her ears can recoil completely. Next is genitalia. So for the premature neonates, female, the clitoris is prominent and the labia is flat. But when the neonate is mature, the labia majora covers the labia minora as well as the clitoris. So just total the scores so that you know the weeks. So you could interpret if the neonate is really premature or mature. That would be all. Thank you so much.